causes heart attack. So, what are the causative factors behind this plaque rupture? Any physical exertion, physical trauma, stress, anger, or morning awakening, this all causes sudden rupture of plaque, which causes sudden heart attack. You already heard, like sudden heart attack comes. So why it happens? Because like patient is asymptomatic, no history of any heart disorder, and suddenly heart attack comes. Why it happens? Because there is a sudden rupturing of the plaque happens, and which is mainly due to all these physical exertion. Now, how we can relate this pathogenesis of atherosclerosis, which it's a very big word to pronounce, atherosclerosis. So how we can relate it, how our Ayurvedic approach can help in this big word of atherosclerosis. So all these causative factors, whatever these modifiable risk factors, mainly, and it causes depletion of our digestive fire, which causes arm formation. Arm formation is undigested food or digestive and metabolic toxins. They causes imbalance of our doshas. This undigested food goes to heart and then gets deposited in rasvaha srotas or channels. Then it impairs the functioning of that channels. Imbalanced doshas also manifest its features in that obstructed channels. Like vata dosha, it mainly causes constriction, or we can say spasm of coronary artery. Coronary artery, which is the heart artery. And then pitta dosha initiates the inflammation, or we can say inflammatory mediators which are released due to the injury of inner thin layer of cell, which are called endothelium cell. And kapha dosha, which causes thickening of the arteries. So all these imbalanced doshas, they manifest check our total cholesterol level, LDL, HDL, and triglycerides. Blood test for to rule out any metabolic syndrome, or we can say disorder, metabolic disorder like diabetes, hypertension, kidney disorder. So we will go for that investigation. Then we will do ECG, which records all the electrical activity and rhythm of heart. In stress test, we use treadmill, myocardial perfusion scanning, which illustrates the functioning of heart muscle. And then echocardiography. It is ultrasound scan of heart, which tells you about all the blood volume, velocity of heart, and functioning of heart. And then ambulatory holter monitoring. It is portable device in which patient keeps under their clothes, and it records electrical activity of the heart for whole day. Like, you know, heart disease mostly precipitated by exertion. So if we can say that if we go for any echocardiography, at that time patient is at resting phase, no feature will come. But in this way, in whole time, like whole day, it records all the electrical activity. If there are any motions come, then it will come on this machine. Then coronary angiography. It is the study of all the blood vessels, which tells you about any blockage in coronary artery, it is present or not. Now, what are the principles of management of this heart disorder in Ayurveda? First, it is prevention of causative factors. That is, avoidance of unfavorable diet and dietary habits. Second, dissolving digestive and metabolic toxins to clear out amdosha or undigested food in our body. Third, clearing of channels to remove obstruction. And fourth, we will use herbs to relieve heart pain and for strengthening of heart and for stress relief. Fifth, it is yoga and meditation, which provides not only mental relaxation but will also provide physical rest too. Now in this slide we will discuss all the favorable diet or unfavorable diet and dietary habits in detail. We have to maintain proper body weight. So for that we have to eat whole food, fresh, highly fibrous and nutritious food. And we have to follow the principles of proper diet. Like we have to avoid incompatible food combinations like intake of salt with the dairy products, or meat with the dairy products, or fruits with the dairy products. There are so many examples of incompatible food combinations. Or we have to avoid overeating, especially due to stress. Then we have to do regular checkup to monitor our sugar level, cholesterol level, and blood pressure. Don't smoke or chew tobacco. We have to avoid all the saturated fatty diet, and we have to include unsaturated food like olive oil, peanut oil, canola oil, sunflower oil, avocado, walnuts, flax seeds. They are good unsaturated fat. Omega-3 fatty fish, and we have to get proper sleep, have adequate rest, and we have to avoid physical exertion. In diet, I want to mention one thing more, that we have to, so what is the unique contribution of Ayurveda in diet? There are types of heart disorders like Vata heart disease, Pitta, Kapha, which I didn't discuss today, because in very short time I can't take all the manifestations of all these doshas. So in diet, what unique contribution of Ayurvedic people, like we provide Vata balanced diet to Vata heart disease, but in modern science they have common diet principles to all the heart patients. They don't customize that diet to heart patient, but for in our Ayurveda we customized. So Vata heart disease, we customize that Vata diet to that people. So Vata heart disease, Pitta heart disease, Kapha heart disease. So for that we will provide Vata diet, Pitta diet and Kapha diet. Next, to improve the digestive fire, we would recommend appetizers, digestives like ginger, garlic, long pepper, raw crushed garlic cloves. They are highly beneficial. And now I will say desi ghee. You will be surprised because everybody says ghee increases the fat. No, you don't have to take ghee. But there is a research that desi ghee improves our digestive fiber and it increases high density lipoprotein, or we can say HDL or good cholesterol. There's something like desi ghee we always recommend in Vata type of heart disorder because Vata is dry in nature and other doshas they are not dry in nature. So we would recommend desi ghee especially in Vata heart disorder. It would be very beneficial in that disorder. And before recommending desi ghee, we have to look the signs of dosha in that person because desi ghee would increase the ama dosha. So first we have to digest our dosha by giving appetizers and digestives. So then after that we can recommend desi ghee. And desi ghee increases our good cholesterol level, which will prevent atherogenesis. And to relieve the obstruction, we would recommend root of Pushkar Mool. It showed negative effect of inotropic and chronotropic effect. It dislodges the obstruction by relieving all that atherogenesis, and it also balances aggravated Vata, or we can say, so
take that. You can see that.
And I would like to thank my family, my husband, my papa, and my mom, who always stand by my side and always give me support. And because of them, I am here today to give this lecture. Thank you so much. Is there any questions? Oh. Thank you, Dr. Sanam Gupta, for that wonderful lecture. And I wish you a good luck in all your future. I welcome Dr. Gupta to present the lecture.
Finish. कैसे बंद करते हैं बस